Welcome back to Me, Myself, and Liberty. If you're just now joining us, I am talking to Robert McMaster. He is running for House District 83, which is an important one because it is currently a Democrat who holds that
Yes, ma'am.
position. So we need to turn that. Okay. So now we're going to talk about your platform. Okay. And I love the three that you have here. So we have healthcare reform, education reform, and criminal justice reform. All three very, very important. And
Yes,
most, I would say, Oklahomans are very concerned about those
Yes,
three.
ma'am.
Okay, so we're going to start with healthcare. So healthcare package to include tax deductible, preventive care, HSAs. I'm going to let you talk about that. So tell the audience about healthcare reform and what it means to you and what you would support as in that position.
Sure. Well, before I can actually get into my ideas, I kind of got to throw some numbers out to you first.
Okay.
Back in 2016, the state of Oklahoma spent $2 billion in the form of Medicaid. That's $2 billion we spent for Oklahomans to go get healthcare coverage. 68% of that $2 billion was roughly for short-term care, like a doctor's visit, eye exam, a blood test, if there was any short-term inpatient stay. So you're talking a vast amount of health care in 1 year being paid for very short, almost preventative services. So I kind of did the very conservative number. I estimated probably 30% of that was preventive care, which means we spent roughly $370 million in 1 year just for preventative care.
Yeah.
So that kind of, how can we try and keep from spending that amount of money? So I was like, well, why don't we leave it for the clinics? Instead of Oklahoma paying them, let's let them keep that money in the form of a tax deduction, a dollar-to-dollar tax deduction. That leaves that $370 million out in the free market, out there as disposable income, so that clinics can invest in more workers, more employees, other doctors, which are other forms of tax revenue for the state of Oklahoma, investing in their business, growing their business, buying more equipment. There's so many different things that the free market will do with that money that it will actually end up helping more people. At the same time, you've got those preventative measures being taken care of. And when you look at health care for the state of Oklahoma, you look at things like heart disease, cancer, diabetes. Oklahoma ranks in the top 5 in every single one of those categories. And if you go and do your research, 5 things on each one of those lists on how to lower your risk of it are things like eating healthy, controlling your blood pressure, watching your vitamin levels, things that fall in the realm of preventative care. If you go see a doctor every year, you're going to know what your weight is. They're going to give you advice on things that you can do better, vitamins that you can take. You know, if you go get a blood test every year, you'll know what your levels are so that you can kind of change your health habits so that you can be healthier. So that's kind of the whole thing behind the first premise of the tax deductible preventative care. People that are lower income, I want them to be able to go see a doctor every year and not have to worry about having to pay for it. And the state of Oklahoma not having to worry about paying for it either. You know, let that money stay with the physicians so that we can use that in an effort to grow, not just on the free market side, but also to get people healthier. Because a healthy populace, it's better for everybody. It's less investment later on down the road that anybody has to do on healthcare because those preventative measures have been taken early on.
Yeah, and Oklahoma is one of the states that isn't necessarily known for its healthy habits. With our state fair, I guess everybody has them, the fried Twinkies and all this stuff.
Yep.
I'm like, of course Oklahoma is a little chubby.
We actually had fried butter at the Mississippi State Fair.
Fried butter. Sounds good.
And the second part of when you talk about healthcare is, well, how can we still take care of the lower income households without it being such a heavy burden on Oklahomans, on Oklahoma taxpayers? And that's where the HSAs and the major medical insurance comes into play. HSAs are designed to incentivize people to invest in their health care. And at the end of the year, they will get interest dividends on the money that they've saved. So what I want to do is for Oklahoma to invest in those HSAs percentage-wise. Right now the percentages are running anywhere from 0.25% to 0.45%, depending upon how much money you have in there. Oklahoma can invest just a little bit of the money, and it can be a part of this $370 million that we potentially be saving to help bump up those interest dividends, to incentivize more people from lower income to invest in those.
Yeah.
Because they're specifically for healthcare. And when you combine those with major medical insurance plans where the premiums are very on the low end, $10, $15, $20, depending upon your age, income, things like that. Whereas we can give deductions for insurance companies that are willing to take even lower rates because they're taking a bigger risk with those plans. The least that Oklahoma can do is to cut down some of their taxes to where they'll be able to do more for other people. Because the less that Oklahoma is having to pay out, the less taxes you have, which means what eventually will happen is you'll see insurance rates start to go down. Oklahoma did a great thing by getting rid of the you can't buy insurance over state lines in 2017. That was a great thing that was done. That allowed for insurance rates to try and come down. Now we need to take further steps. We need to look at where we're spending a lot of money, whereas maybe instead of spending this money, we give it as a tax deduction to clinics, to doctors' offices, to medical hospitals, so that they can turn around and reinvest that money still in the free market. More employees, more bigger facilities, to where it's not only Oklahomans get healthier, but businesses are able to grow, and that helps out everybody.
Yeah, and there are really so many options now. The Obamacare mandate was just a killer. I mean, it just killed the free market here. A perfect example is, I don't know if you've heard of Salerno Health, but they started back in, 14, 13, I don't remember the exact year. But basically, they were a membership-based program. So you paid, $50, $60, $70 a month, and you had access to a doctor. And once you're an established patient, they could talk to you over the phone and prescribe if needed, that kind of thing. And so we were members, and we had that for our employees as well. So they were able to go see a doctor, and it wasn't hundreds of dollars a month. Well, we went from that to when the Obamacare mandate went into place. It was crazy. It was like $1,400 or $1,500 a month for our family. That was it. And I mean, like, who can afford that? I mean, and then, we have the repeal. Well, now we're back into a situation where there are these membership-based programs that are out there. We're a member of one, and there's one. I mean, they're all over the place now. But you literally pay, whatever their fee is monthly. You have access to a doctor. You're not paying co-pays when you go in, and lower income people can afford that. I mean, it's not major medical, but you pair a major medical with that. There's so many options out there now. There's no reason for health insurance costs to be as high as they are.
Yep. Well, and what Obamacare did, and I don't know if they knew what they were doing when they put it in, but it had a consequence that some people may not have thought of. Once you mandated that every insurance provider had to take on a customer, it didn't matter if there was a pre-existing, which I don't disagree with that. I'm okay with. But when you force everybody into the healthcare market and say, well, if you don't go into it, you're going to pay a fine. People who were healthy didn't really need to go to a doctor hardly ever. They looked at the expense. I'm going to pay a lot more in health insurance, or I'll pay a little bit and I fine at IRS. I'll just pay the fine at the IRS. Their hope was the young people would be in the market as well, which would offset the expense from those who needed more medical care, since now they can be insured. They have to be insured. So that drove the prices up, because the only people that were staying in the market were those that either could afford it or had to have it. So that forced more people onto Medicaid, which means more of government money going into it, which means your taxes are going to have to be higher or offset by other things you're paying higher money for. So instead of going to the extreme effect of, well, let's just have government pay for everything. No. Free market is always the best way to handle a situation. If you incentivize them to help out those that can't afford it, it actually ends up helping out everybody.
And they will. Yeah. And they will. I mean, I think about the AMP, I call it the AMPM clinic by our house, the urgent care, whatever. I mean, they have cash prices for people that don't have insurance, and they're not crazy. I mean, it's under $100 to go in and get a strep test, get an antibiotic, and all that, and be on your way. And not everybody can afford that $100, but most people can afford it if they're in an emergent situation where they need to get health care.
Yes.
So, okay, well, we're going to take a quick break, and when we come back, we will wrap up healthcare and get into education reform.
Yes,
Okay?
ma'am.
All right.